Hello, I'm Dr. M. Welcome to VMC. Today we are going to be covering feline house soiling. This is going to cover the most common reasons for a cat to be eliminating outside of their litter box. Join me, you'll learn something. So far and away, the most common reason that I will see cats who are house soiling ends up being because the litter box husbandry in their home is not correct for that cat. I've already done a video on litter box husbandry. I'll link it here, and if you haven't watched it yet, that's the first place you need to start. Having the correct substrate, having the correct litter, having the correct box, having the correct placement, having the correct number of boxes, all of these things matter a lot. So make sure you start there, implement everything that video talks about. Now, if you've already done that, step 2 involves seeing your veterinarian. Make sure that you go through the basics of medical testing to screen for the more common issues that can contribute to house soiling. So to start with, we need a blood work panel. This is to check for issues like hyperthyroidism, diabetes, kidney function problems, etc., that can cause an increased urge to urinate, and so your cat may not be able to hold it long enough to make it to the litter box anymore. Second, we need to be doing a urinalysis. Now this will check for things like crystals in the urine. Urinary tract infections are actually fairly uncommon in cats, but we still should always check for them. It's crucial to remember that if your cat does have crystals in their urine, this is also an incredibly painful issue to have. People that have urinary crystals report passing them feels like urinating out razor blades. It hurts a lot, and so it's very important that your cat is receiving pain management while we are working on the other treatments to try to resolve the crystals. And the urinalysis will also help to check kidney function as well. We need to make sure that the kidneys are able to concentrate the urine. Third, if the blood work test and urinalysis come back within normal limits, then we need to move on to an ultrasound of the urinary tract. So that means kidneys, ureters, bladder, urethra, and this should be done by a skilled ultrasonographer. This part's very important because we are looking for bladder stones, kidney stones, ectopic ureters, inflammation in the bladder wall, which is called cystitis, masses in the bladder, abnormal anatomy concerns, maybe there is a urinary sphincter problem. You know, there are just a bunch of issues that need to be ruled in or out. Now, the things that I have mentioned so far are necessary for house soiling that is urination. Some cats will end up defecating outside of the litter box, and a medical workup is also necessary for those cats. Considering x-rays is important because the way that a cat postures to defecate, if they're having issues with their back or with their hips or with their knees, ankles, you know, any sort of pain in any of those areas, that can cause them to feel that pain while they're inside of the litter box, and then they end up thinking that the litter box is causing them pain, so they start avoiding the litter box, and that is not the cat's fault. From their perspective, it makes perfect sense. So then they start house soiling. It's also important to be checking for issues like irritable bowel disease or megacolon. Those sorts of issues can cause an increased need to defecate, so the cat might not be able to make it to the box, or it can make defecation painful. Colitis can also be contributing. So if you're having a cat that's defecating outside of the box, checking for those things, ruling them in and out is very important. And if nothing is noted there, it's still very important to do a pain medication trial. This is because our cats can't tell us if they're hurting somewhere, and there are a lot of issues, especially neurological type issues, that doesn't show up very well on our x-rays. For a lot of cats that are house soiling, that are painful, if we can just control their pain, they'll start going back and using their box. And when they're house soiling, they're just saying, hey, I feel really awful and I need you to figure out what's going on. So it's our responsibility to do that. What I have to mention is that if you ever notice your cat going into the litter box, not being able to eliminate, maybe they're vocalizing while they're in the box, maybe they're going in and out of the box frequently, maybe they're posturing, trying to eliminate, and you're just not seeing them produce any urine or feces, that is an emergency. It's fairly common for cats to get urinary blockages, and this is life or death. You must rush to an emergency clinic immediately. Have someone else call them while you are driving and get your cat to them right away. If there is delay, this can wreck their kidney function and they can end up dying from this. So it's far better to be safe than sorry. And even if you're seeing straining and maybe just not as much urine as normal, still an emergency. These cats must be evaluated. They need incredibly intensive pain management and they need to be treated for the partial or full urinary blockage. Now, we also know that after going through all of those tests, there are going to be some cats that we don't have a clear answer for. And a lot of those cats end up having cystitis, which is inflammation within the bladder wall. And this is excruciatingly painful. People that have it will say that the pain is intense and awful. And so these cats do require intensive pain management, and it's one of the things that we are looking at treating when we do a pain management trial. And you do need to be pretty aggressive with your pain management trial. Sometimes an anti-inflammatory like Onsior can be used. Other times we will use a medication called buprenorphine. Sometimes we will trial both together because the two medications together will do a better job with pain control than either one would do on its own. It should also be noted that if you are working on a stress or anxiety component or maybe a marking component to house soiling, that while you are waiting to rule out all the medical issues or waiting for an appointment with a veterinary behaviorist, you can use the over-the-counter options that we have available to us. One is called Feliway. It is a synthetically produced pheromone that in one study that was done showed it reduced house soiling in just about 60% of the cats that a Feliway diffuser was implemented for. This is very helpful, and if it does help your cat, that's fantastic. The diffuser will last for roughly a month, so giving it a try is a good idea. And you could also trial Zilken or Zilkene, depends how you want to pronounce it. It has tryptophan and casein in it. It does come as a capsule, but you can open that capsule and sprinkle it onto a little bit of canned food for your cat. It's fairly palatable. Most cats will eat it like that, no problem. And this can also help to reduce mild amounts of stress. As with all behavior things, there isn't ever a one thing fits all for behavior modification. And so working with someone who uses positive reinforcement to set the cat up for success, to teach them where to eliminate, and to reward them for doing so is very important. So we know that with punishment, if you are yelling at your cat or spraying them with water or hitting them or whatever else people do, any of those things increase the stress behaviors, and so they will not help to reduce house soiling. If anything, they will worsen it. So it's incredibly important not to do any of those things. I know that house soiling is a very frustrating thing to be dealing with as a person. So it's very important that we think about this issue as very, very likely to be a medical one, that we need to work with a veterinarian to find that medical cause. And if all of the medical possibilities are ruled out and a pain medication trial was done with no help, then it's time to see a veterinary behaviorist and get their assistance to work on the stress and anxiety component that can be contributing for some cats. And so trialing medication to reduce stress, often gabapentin or trazodone is used, as it can take effect fairly quickly. And if that is beneficial, then going to something that is a bit longer acting, like fluoxetine, can be used. The most important thing though is that we cannot skip the ruling in or out of the medical issues and just jump to assuming it's behavioral. If your veterinarian says that to you, you need to find a different veterinarian. That is old information, and we now know it is not accurate. The vast majority of these patients will have something medical that is contributing to the behavior. To help with treatment for cats with feline lower urinary tract disease, we are lucky enough to have a number of prescription diets. The most commonly used ones are from Royal Canin and from Hills. They have canned foods and kibble, and these foods are very carefully formulated to keep the urinary pH just perfect, to minimize the chance of crystal and stone formation in the urine. And these diets also help to improve bladder health and to keep the bladder wall less inflamed. And these diets include some supplements to help with stress that the cat might be feeling. And because some cats, especially some with cystitis, will get flare-ups of that bladder inflammation when stress enters their lives, these foods can be very literally life-saving. And so if your veterinarian is recommending a prescription diet for urinary health, you absolutely need to transition your cat onto it. If your cat is house soiling, make sure that you are very fastidiously cleaning up any areas where they have soiled, and you have to use an enzymatic cleanser. My all-time favorite is the unscented anti-icky poo. It by far works the best of any of the ones I've tried. However, if you find another enzymatic cleanser that's unscented, go for it, give it a try. So as long as it's an enzymatic cleanser, use it as the directions say. All right, well, I hope that you've enjoyed the information in this video today. Please comment down below if you have a suggestion or idea for what you would like me to cover in a future video. Please also like this video if you enjoyed it. It really helps me. Subscribe if you haven't already, and I look forward to seeing you in the next video. You take care. Bye.